Why are these? This is talking about full thyroid panels done by most doctors when patients have all the symptoms. Well, there's a few reasons for that. One is that you don't get a lot of training about endocrinology in medical school. Number two is that the literature when it comes to thyroid is actually very controversial. For instance, there's some studies that really support using T3 and other studies that don't support it. So unless you have a lot of experience with treating thyroid patients and you're motivated to get results but do them safely, because overdoing thyroid can also be quite harmful, then your chances of treating thyroid successfully as a physician are pretty low. So it takes experience, and it takes really knowing the literature on both sides, the controversial literature when it comes to this. For me, I was motivated to look into it because I myself had Hashimoto's thyroiditis, and I had a really hard time getting help treating it correctly. And I did meet some endocrinologists that actually had experience treating patients with it who had normal thyroid labs, who helped to train me. And I also went back to both the basic science and the clinical literature to really get a good idea of what was going on and to balance that for my patients. This was many years ago, so now I've had lots of years of clinical experience. It's something that I can do successfully and safely. There are also some ways of dealing with autoimmune thyroid disease that actually don't necessarily require medication. So as with all autoimmune diseases, going to root causes, things like intestinal health and inflammation and health habits can really have an impact on what happens with Hashimoto's thyroiditis. So that's one other reason that doing the labs for me is really helpful, because I have the type of practice that really emphasizes lifestyle change.